Hey, it's Josh from TrustDrivenCare.
And I'm Rebecca from Better Doctor Project.
Good to see you, Rebecca.
You
Hey, I
too.
would love to talk today about patient anxiety, especially kind of that hurdle we got to get our patients over. Have you seen a lot of anxiety in your patients when you're talking about different things?
Yeah, I think it can come from a lot of areas in healthcare. A lot of it starts with that initial medical condition and trying to understand what in the world it is. And then it can
Yeah,
progress when they try to figure out, okay, now that I know what I have, what do I do next?
yeah. Do you think that this affects that patient provider relationship? So we are always talking about let's build trust, right? Build that bond between patient and provider. But what have you seen, or do you think it has a big effect on that relationship?
I do. When you're talking about anything in the world of anxiety and depression and mental health, I mean, wouldn't you want to talk to a provider that you can trust and someone that you can relate to? I mean, I'm sure that's why you've been so successful, as you are so relatable. So yeah, I completely agree. I think it really affects that provider patient relationship, and we need to be ready, and we need to be able to find out if someone is struggling with medical anxiety or not, and know how to kind of intervene and help them with that.
Yeah, I think a lot of times we underestimate, like in the case of referrals, for example, if I refer you for an MRI, simple procedure, right? But if I haven't prepped that patient properly and they go to that and it's very different than they thought their experience would be, right? I don't know if you've ever had an MRI. I've had one and it's incredibly loud. It's incredibly claustrophobic. And I always think like, if I just say, "Oh, Rebecca, just go get an MRI. You'll be in and out in 5 minutes," and yet it's this half-hour loud procedure where it's scary. It's you're nervous. The the stretch I'm asking for in our relationship from you trusted me to send you the right thing, and now I have, but I haven't really talked to you about what it's going to be like. That's really almost tearing at that relationship, right? I let you down in the fact of not telling you quite all about it.
I love that example. And before we dive into this a little further, that right there can be applied to almost any specialty in healthcare. There's a lot of
Sure.
providers out there who are scheduling advanced imaging. Can you pretend that I'm your patient and kind of walk me through how you would explain that to me? Because, it's
Yeah.
always tough. We have to kind of walk that fine line of medical terminology and layperson,
Yeah.
terminology. And I would love to hear from you how you've found success with that.
Yeah, it's funny because as soon as I had my first MRI, I spent literally the entire 30 minutes thinking, "Oh my God, I've let every patient down that I've ever sent for this." And my mind was racing with what to tell them. So
Yeah.
here's kind of my thing. I always say, Rebecca, at this point, I need a better picture of what's going on with your condition. So we're going to send you for an MRI. Have you ever had an MRI before?
So, yeah, I've never had one before. What's it like?
Yeah, I'm glad you asked. So I want to prep you properly because it is a little bit of a nerve-wracking procedure. It can be really loud. So what you're hearing is the M in MRI stands for magnetic resonance imaging. So that magnet is spinning around your body. So you're going to hear this thing going. That's the magnet spinning around. Now the good news is when that thing spins, it gives us a much better, crisper image, and that's why we deal with all that noise. But don't worry, they have headphones that you can use in the procedure. If you just ask them, they'll often ask you what kind of music you like and whatnot. So you put on some headphones, and that takes away some of the noise. The other thing is you're going to be laying on a bed, right? And the bed will slide in and out of the magnet. Okay. Now, if you're a big guy like me, my shoulders almost touch the sides of the magnet, so it can be a little claustrophobic. Do you have any issues with claustrophobia?
I think I'll be okay now that you warned me.
Okay, cool. Well, if it's ever an issue, you can just ask them for some medication, and they're happy to give that. It's super common. It's not an unlikely thing that you need a little help there. So if you want to do that, that's fine. We just want to prep them in with enough notice.
So let's pretend you had 10 patients that you gave that explanation to. And let's pretend you had 10 patients that you just said, "Hey, I need an MRI. Let's schedule it." And you move on.
Right.
I would be so curious to know what those outcomes are going to be like. What are their
Sure.
anxiety levels like?
Right.
What are their general perception of the procedure itself? What's their general perception of you and your co-management? I mean, the
Yeah.
list goes on. So
Right.
obviously we need more research on this, but we actually found an article where this was studied not too long ago.
Really? Okay. Well, let's dive into this. So Who looked into us and when did they do it? Give us some details here.
Yeah, so back in 2016, there was an article titled The Effects of a Take-Home Educational Video on Patient Knowledge Retention, Anxiety, Satisfaction, and Provider Time. This was done by
Super short title, as usual.
Right?
We like those.
This was done by Gadler, Chris, Branstein, and Schneider. And what I love about it is that they picked something pretty specific, but something that can relate to quite a lot. They looked at patients who were scheduled to have prostate cancer surgery. And they were
Now,
really, go ahead.
One thing I think that's interesting is in the world of cancer surgeries, that's one of the ones they say is, oh, that's so easy. Like that's not a big deal. And it's an in and out type of procedure. Prostate cancer is incredibly, it's the borders are typically clean. You're not really worried about metastasis. It's one of the simpler cancers, although it does have the word cancer on it. But let's just put in perspective what they're studying. They're studying a cancer procedure, but all the surgeons probably think like, oh, this isn't the NFL. This is really rookie school for doing surgeries, right? And so it's, again, presenting that idea of not a big deal to the provider, but to the patient hearing that you have to have prostate surgery is immense. The weight of the world is on their shoulders as they go in for it.
And that's exactly what they were thinking with this research. They were thinking, okay, there has to be some kind of anxiety component. How can we intersect this and change that? So it was really simple. They just made a little take-home educational video, a couple minutes long, and they gave it to some of the patients and didn't give it to some of the other ones. And the results were pretty crazy.
Yeah. Well, what all did they find as far as the results? Like, because measuring anxiety is a tough thing. You got to get you diving into that. And whenever you measure the anxiety, probably wasn't the moment the knife was going to cut the skin. Like that's when you're scared to death, right? Or when you feel that anesthesia take over, you're wheeled in, you're super nervous. But I'm interested to see what they found.
Exactly. And I think some of the results were kind of expected and then some were not. So the top 4 things that they found was the obvious one. Of course, they ended up having a reduction in patient medical anxiety, which is great. One of my favorite ones, they found increased patient knowledge retention. So not only were they less anxious, but they understood the process more. They actually understood their medical condition more because they were forced to learn about it. It also resulted in some increased patient satisfaction, which as a provider, what more do you want? And then my personal favorite, it actually saved post-operative provider time. A lot of the things they were having to discuss with these patients after the procedure, they didn't really have to do as much with because they already knew. Right. So I think those are all some really good points.
Yeah, I think that people underestimate that. We as providers, I think, underestimate how much more time we can get back when we also do something that serves our patients better. For example, my son just had surgery on his ear, right? And the doctor 3 different times told us, listen, a little bit of bleeding's okay. A little bit of bleeding's okay. We want it to bleed a little bit because that means fluid is flowing out, not going in and getting infected. So if you find a little bit of blood on his pillow, if he, has to dab it throughout the day, those are all positive signs, right? Now, smash cut to 2 days after surgery, I wake him up to go to school and there's a bunch of little splotches on his pillow, right? Of blood. If I hadn't had that information, I, as a very concerned parent, might have been dialing, calling the office. Oh, he's bleeding. And should I, cancel his school? Should I keep him home from school today and come into your office, et cetera, et cetera? They would have had to emergency scheduling me, right? That's one more person in that morning. I'm freaked out. He's freaked out. Everybody's freaked out. And the doctor might look at it and go, that's exactly what we expect. But what he had done instead is 3 different times, and I counted because it was so impactful. 3 different times he said, a little bit of bleeding is, totally expected, and prepped us to see a little bit of blood on his pillow in a way that it wasn't a big deal. And therefore, I didn't clog up his schedule. I didn't keep my son home from school. Therefore, I didn't need a note to turn him back into school. If he misses for a medical appointment, we have to provide a note. He eliminated all that by having a very simple conversation, and a little bit of bleeding was okay.
It's always worth it to over communicate. And by just taking literally a couple seconds to remind you that 3 times, he saved himself, dozens of minutes after the fact. So I always tell any students I'm working with or young docs, I'm like, just take a few seconds to save you those minutes down the road.
Right. Now let's talk real quick. Can you think of one or two areas where we as chiropractors, so I mean, we're not dealing with the C word, we're not dealing with cancer and these life-threatening conditions, but certainly our patients are worried and they're concerned. But where are some areas that you think a good conversation might occur where we can reduce that anxiety? For example, one thing I know that a lot of our people watching this probably have anxiety themselves around and their patients is talking about insurance and the cost and reimbursement, right? Especially if, this conversation of, oh, I have really good insurance, and then we verify their benefits. And in fact, they don't have great insurance according to our standards, right? And so you're going to have to talk to them about there's an out-of-pocket cost here that we need to discuss. That anxiety is building in the provider, probably that anxiety is building with the patient. And if those two things collide, that they're going to spend 10 or 15 extra minutes in that room explaining that, right? Now it's chewing into their schedule, et cetera, et cetera. And I think having a pre-made video about what the heck's a deductible? What is a copay? What does that mean? Sending that out before that discussion of finances based on this research might be a really good idea.
Yeah. And again, that really wouldn't take long to do at all. It could be automated. It could be the second someone schedules a new patient visit with you, that email goes out and explains that stuff to them. I think it's really valuable because then that patient is not walking through your doors and the entire first visit sitting in that chair. You don't want them to be thinking about dollar signs. You want them to be thinking about, how am I going to better myself? What can I learn from this provider? How can I get better? So it changes that mental dynamic really, really largely. And, remember, we've studied also that we need high quality thoughts and positive thoughts in order to increase our outcomes even more. So just by a simple change like that, I think that's a great way to reduce financial anxiety as well.
Yeah. And I'm thinking now too, I wonder if you just wrote down your 10 most popular or most common diagnoses, right? Like what are the 10 conditions you see more than anything? And in most offices, it's going to be the same thing. So for you and I, it's facetogenic low back pain, disc-based low back pain, facet and disc pain in the neck, right? Shoulder impingement. What else? Mechanical low back pain, sprains or strains. Like you would come up with a list of your top 10. If you just took those and did like a very short, maybe 2 or 3 slides on something like Google Slides, and then recorded yourself delivering like, hey, the diagnosis, your diagnosis is facetogenic low back pain. Here's what the facet joints look like. That's why it hurts when you lean back. So our goal is going to be to adjust that area and then strengthen your core, blah, 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 blah. We look forward to your next visit, right? How long would it take to shoot that video, put together a few slides, and how many patients will that affect your first year of delivering that via text message, right? Sending a text message automatically with that video attached.
Well, and I also like to remind providers that if you, for whatever reason, are not comfortable making that short video yourself, there are people out there that are doing it. So technically you could use hyperlinks and you can send them resources that maybe you didn't make yourself to accomplish the same goal. It's truly a matter of looking within yourself as a provider. What are my strengths? What are my superpowers? But also finding your weaknesses. Like if you cannot find it within you to make a 2-minute video on discogenic low back pain, that's fine. Find someone who did it well and use that resource that's already out there. But either way, you need to find a way to deliver it to your patients to help with those outcomes.
Yeah. And ultimately, this process will help deliver, build that relationship and that trust between the providers and the patients, right?
Always. I mean, like we always talk about, communication really does matter.
Absolutely. So if you want to improve your patient communication and get 4 times as many reviews, probably based on the fact the review might say, I love Dr. Rebecca. She sent me a video that explained everything going on with me, right? And it's just a 2-minute video. But that's the stuff that gets 4 times as many reviews and 2 times as many internal referrals because people trust you, they love you, and they trust you with their friends and family. If you're interested in that, then check out TrustDrivenCare.com. Thanks a lot, Rebecca.